Morning, good evening. You're welcome to this webinar tackling mental health challenges and crises of the Black child across continent. Okay, so we'd like to welcome you. Thank you for joining us. This webinar is part of the Africanist focus area. Africanist focuses on kindness to oneself, kindness to others, and kindness to the world all around us. My name is Chinyere Okoro, and I'm a smart recovery facilitator from Nigeria and also run the vlog Emotional Intelligence with Chi. And I will be your host for today's webinar. So I'll get right to it. So I'm going to go through the agenda for this webinar, so we'll all be guided, and then I will introduce you to our speakers and share some announcements, and then we kickstart. Okay. So today the agenda is going to go to us. We'll start with a brief introduction and talk about the statistics of mental health in children and young adults across continents, both in Africa and in the UK. Then we'll talk about risk factors for these mental health situations in the UK. We have taught people to help us discuss that. We'll talk about why mental health challenges are even possible, especially for Black children who are immigrants to the United Kingdom, and what supports are available. Then we'd also talk about how that plays out from the African setting. Okay, talk about how that plays out in the African setting and what are the risk factors from Africa. Then we'll share some solutions and recommendations, and then we'll take questions from our audience. So we're going to kick start. I would like to introduce you to the amazing panelists who will be joining me today on this conversation to lead us on this talk. And I would start. The first person on my list is an award-winning senior psychiatrist, a Commonwealth scholar, and a child mental health professional. Yes, he's currently doing his PhD in the University of Cambridge, and he has worked a lot with children and young adults, a lecturer of behavioral sciences at the Kwame Nkrumah University of Science and Technology, Ghana. He's also the vice president of the Psychiatric Association of Ghana, and we'll hear from him from his research work, his experience as a psychiatrist, and all the insight he has to share from us to us rather. Please welcome with me Mr. Kwabena Kusimensa. You're welcome, sir. Thank you for joining us. Secondly, we have Mr. Ebuka Ede. He's the CEO and the founder of Save the Boys Initiative. He has over a decade of experience working with boys, teenage boys, adolescent boys, young adults, male young adults, and also working with parents. He's been helping in breaking and overcoming addictions in boys and behavioral malfunctions that are present in these boys. He has years of experience and success in this. He has received the National Volunteer Award in 2020 for his work. He's a TEDx speaker. He's also a father himself, very important for us to know. And we're going to hear from his real life experience working on the Save the Boys initiative. He'll be sharing with us some real life experience. Thank you for joining us, Mr. Ibuka. And then we have a counselor who provides psychosocial support. Yes, from Nigeria. She also works with the Lagos State government. Miss Omobolanle Ido. You're welcome, madam. Thank you for joining. And next is Miss Lakewande, a first class graduate with a master's in mental health nursing. She would shed light on the approach of the NHS, the National Health Service Foundation Trust, as it relates to the issue at hand. Welcome, madam. And next is Mr. Abraham Adetula. Yes, a senior mental health worker at the NHS Foundation, skilled in psychotherapy, addiction, and substance rehabilitation. And he was a former lead psychologist for Garki Hospital, Abuja, a fellow of the Young African Leadership Initiative, Accra. He would also shed more light on the issues as it surrounds Black children in the UK and the role the NHS has to play in that. Thank you, Mr. Adetula, for joining. Also, we have some teachers, some educators with us. Yes, first up is Dr. Modupe Oba Adenuga. Yes, she's an educator of educators and professionals of a professional of educational psychology at the Tai Solarin College of Education. She's the chairman of Colleges of Education Academic Staff Union and the acting director of guidance and counseling services at the Tai Solarin College of Education in Nigeria. She has over 2 decades worth of experience in tertiary institution. She's a member of the Association of Behavioral Research Analysts, Psychometrician, and she has also received some volunteer awards. It would be good to have her here. You're welcome, madam. And then our last panelist, and definitely not the least, is Mrs. Ibi Oshinowo, an educator and a support for learning teacher at the Robert Gordon College in Scotland, in the UK. She's highly trained professional with a decade of experience in the education sector, certified in mental health first aid, counseling children and adolescents. She has a PGCE in inclusive practice from the University of Aberdeen. She brings to discussion her wealth of experience working with children and young adults, as well as teachers in the United Kingdom. You're welcome, Madam Ibi.
Thank you.
Okay, so I would next go to the announcement I have to make. First of all, I want to appreciate you for joining, and I want you to know that this session is going to be recorded and shared with everyone that has registered. So, in case you joined in, maybe from the a link someone shared with you at advice, you go ahead and register so your email is captured and the recording will be shared with you. Also, you have an opportunity to send us questions. Yes, so go ahead and type in your questions from whatever platform you're joining in, Instagram, YouTube, or Facebook Live, and would take them at the end of the session. And also, as you're joining in, we encourage you to go ahead and take up highlights or some points and share your social media handle. Please remember to use the hashtags hashtag Afrikindness, hashtag mental health, and hashtag be kind. Hashtag Afrikindness, hashtag mental health, hashtag be kind. Thank you so much. All right, so let's get to it. It is obvious to all of us the need that mental health has taken, especially in the current world and situation where we are in. Every day, our news is filled with tons and tons of information of mental health of children that have been neglected and the resulting effect. We see and hear of a lot of behavioral changes and progressions that are maybe tear cursing for some people because of mental health issues that are not tackled. Okay, lots of children are going down in depression, even taking their own lives. And as much as every one of us is concerned and would want to do something about it, and that is why we are here today to talk about it. So I would start with you, Mr. Mensah. Yes, please. Could you tell us some more about the actual statistic base of things of mental health in children in Africa? I know you've done some research there. Could you share with us?
Yes. So thank you very much for the opportunity, and grateful once again to be here. I'm going straight to the question. The bottom line is that Africa does have a major burden, contrary to previously held conceptions that
Yes, sir,
used
you're
to
up.
be floating around, that mental illness is something that is Western or foreign. We are increasingly coming up with more and more data. There's not a whole lot of it, but more and more data that's showing that we have comparable prevalence data to worldwide figures of child and adolescent mental health disorders. In terms of current prevalence, so when we say current prevalence, we mean like within the last people reporting a diagnosable mental health condition within the previous 12 months. Figures are hovering around somewhere between 15 to 20%. My own research from Ghana placed it at around about 18.6%. Research from Nigeria, done by
Well,
Professor Bibodun,
yes, Mr.
places
Mensah,
it.
are you with us?
Yes, can you hear me?
Yes, we
Hello.
can hear you. Go on, we can hear you.
All right. Yes.
Yes, we can
Yes.
hear you.
Yes, sir,
Right.
please
Yes.
go
So I
ahead.
was sharing data about current prevalence, and by current prevalence we mean like within the last 12 months, if you have a diagnosable mental disorder, The current prevalence in Africa is hovering between 15 to 20%. My own research from Ghana placed it at about 18.6%. Research from Nigeria, from Professor Mibodun's research, places it at about 19.6%, which is hovering around that mark. And then lifetime prevalence. So lifetime prevalence means at any point in your lifetime. So beyond that 12 month period. Ghana's data showed something around 30.4%. The range is between 25 to about 34%. So there's significant, diagnosable mental illness, but unfortunately, a lot of it goes unrecognized. And I'm sure we'll be unpacking that as we go along. In the UK, I believe the data that I've seen, which is a bit dated, showed current prevalence of about 10% or so. Research done maybe 15 years ago by Goodman and Ford showed a current prevalence in the UK of roughly about 10%, but it's probably a lot more since COVID and and things like that, and the data is still coming up gradually. But the point is that yes, Africa, we definitely have our issues with mental health illness amongst children and adolescents, which is largely going unrecognized and undiagnosed. Yeah. Hello. It looks like
Thank
people
you.
are complaining that they can't hear me.
No, we can hear you.
Yes.
Okay. Okay.
We can hear you. We can hear you clearly.
Okay. All right, Sam. So thank you for sharing that. Though I had a little bit of challenge hearing you at some point. Would you tell us why the statistics of these Black children suffering mental health challenges is incredibly high? Could you tell us what is the cause? So why is that the case?
On mute, please. On mute. On mute.
The burden is quite huge. West Africa has about 350 million people. About 55% of our population are under 18. So that works out to roughly about 192 million children. Now, even if we use the conservative figures of current prevalence of, let's say, 15%, that works out to about 29 million undiagnosed children who are suffering under the burden of mental illness, which is quite stark, really. There are several reasons to this. I think a big part of it is a lack of awareness generally. One of the biggest things that I hear a lot when I tell people, like even my classmates, I told them that I was going to do child and adolescent psychiatry. Is now children too, do they have mental problems? We've actually done research in
Wow.
Nigeria where that's one of the commonest responses that as for children, what do children have to think about? And children are happy, carefree, they don't have problem, and now that goes to show the kinds of perceptions and mindset that people have. So there's a huge lack of awareness about the fact that yes, children have mental health conditions, and have burdens and have problems too. A large chunk of it too is also partly because of a lack of expertise, really. I mean,
Yeah.
myself in Ghana, including myself, there are about 5 people in the entire country with any training in child and adolescent mental health. And that's for a population of about 17 million children, So where are the people who are going to be advocates for this type of thing? We don't have tools, the right tools, and I'm sure we'll be talking about that later on, that are culturally appropriate, that would even begin to diagnose these children, pick them up from the schools, the children who are struggling in our classrooms and things like that. There isn't political commitment. That's the truth. I mean, generally speaking, there is a lack of political commitment in Africa to children's well-being. I mean, it's always, even culturally, when we have events, if there's a wedding or whatever, the children are like an afterthought. They're in some corner somewhere. They have the least, the scraps of what is left over is what we give to them. And it translates itself in national policy. I know in many African countries, there isn't even a policy, but a government policy of, okay, so this is what we want to do for children's mental health. It doesn't even exist for you to even be able to hold the governments to their own policy. Talk less of resources. Mental health generally is like less than 1% of the 1% of the budget to healthcare. How much more children? So there's multiple factors, but and so if all these things are not in place,
Yeah.
and you are just expected that to as they say, suck it up and just get along. And I mean, you hear people say, oh, after all, in our time when we were children, we were walking to school barefoot and things like that. So you people who have come these days are even lucky. What is this children's mental health?
Wow.
So there's a real misunderstanding of
Yeah.
the issues that face children. Yes, and that we really need to
That's
address.
that's thank you. Thank you so much, sir. That's kind of saddening. People underrate the mental health of state of children, and like you said, lack of expertise and lack of awareness. So
Mm,
more like people don't know and they don't even want to know.
to know.
Wow. Wow,
Absolutely.
this is intense. Well, let's move on. Thank you so much, Mr. Adetula. I'd like to ask you, what is the statistics in the UK? We've heard from Mr. Mensah of the state in Africa. What is the statistics in the UK?
Oh, thank you very much, and I'm very, very happy to be here.
Yes.
When we are looking at statistics in the UK, I don't want us to look at statistics general because we are talking about black and ethnic minority, and I'll be looking at them because the statistic is a funny one. For example, if you look at the statistic for patients that are actually deprived their liberty under Section 2, Section 3, Section 135, 136, we realize that black children and ethnic minority, they are 36% of people that are detained, but they are just 11% of the whole of population. So this shows that there is even disparity when it comes to access to mental illness treatment and how they are treated. Another thing about statistics within the UK and blacks is the funny one is that when it comes to referrals, GPs that are voluntary referrals are 10 times less likely to refer a black child to mental health service. And majority of mental health service black children have access to, they are being referred to by social worker and youth worker. These are the people that have to refer you when things are gotten out of hand. So the statistic simply says that even when black children go to their general practitioner for treatment and for access, GP are less likely to even refer them. They feel that they are okay because most of the symptoms that we present are largely different from how a white child present. And
Wow.
and and there are some other factors that may not allow even black children to come for access. One of the things we treated recently in our trust is the fact that children that have parents that are migrants, they are less likely to come for mental health patient because they feel that the information gotten them might impact their visa at the home office. So they are like, don't let us go there because we want to renew our visa in 1 year. What will happen if we tell these people that we have a child that have mental illness? What will happen if we say if we tell two of our children we have to be detained under the mental health act? What are we going to say if we want to apply and say, okay, presently some of our children are not okay, they're having mental. So those are the things that might actually impact mental health access for black children.
Indeed.
Another thing that is very, very funny is the social inequalities that are associated with mental health is very, very common among black children. For example, if you look at the World Mental Health Day thing for last year, it says something about mental health in an unequal world. We know we live in an equal world, but the inequalities that are associated with mental illness, such as poverty, living in deprived environment, living in council house, are more specifically common in black children, especially when it comes to central London. And those inequalities does not give access to so many things. For example, black children are less likely to have, when it comes to central London, they are more likely to live in a council house. They are less likely to go to government school where they take feeding. They are more likely to live in a divorced family. They are more likely not to have proper education because they have a dysfunctional family. So all those things impact levels in which we have impact prevalence of mental illness among black children, because if we are not able to resolve inequalities associated with mental illness among black children, we will not be able to give them right and appropriate treatment that they want. Because if you are treating, you will be treating only the symptoms and not the social inequality that predispose them. Because if you look at, for example, if you look at immigrants, one of the things we found when we assess children that came from Nigeria to the UK is shame. Everybody shame you for your intonation. You know, we have a child sometimes ago, the child got to school and got to the point that he wasn't talking again. You know,
Yeah.
the friends are saying, "Get out there." You know, because the way he speaks is different from other people. So those things
Okay.
that cultural shock impact mental health
Yeah.
across body. Yeah. Thank you.
Thank you. Thank you so much, Mr. Detula. This is intense. So even in the UK as well, there are major risk factors of inequality. And like what you said, the GPs, I'm guessing you mean general practitioners, is that it?
Yeah. Yes.
Oh, okay. Are less likely to refer someone with a mental health challenge. So there's fear, and people are afraid of what could result from them being identified with a mental health illness. Wow. Thank you so much for sharing all of those insights, sir. Madam Ibi, please, I'd like to move on to you right now. As an educator in the UK, yes, please, could you shed more light on how immigrant children, especially people of first generation that moved from Africa to the UK, what kind of mental burden are they faced with? How does it affect their mental health state? We understand the cultural shift, the change of location, and like Mr. Disla was just saying, the language difference and intonation, accent difference, and all of that. As from your experience, madam, how does that play out for the mental health of the African child or the black child in the UK?
Thank you. Well, from my experience, like you just rightly said, they come across crisis. So you can say, you know, in situations like that when teenagers, adolescents normally face, you know, have the question of their identity anyway. You know, they're coming
Yes.
in and they're wondering, who am I? And then how much more? It's a normal developmental stage of every child, you know, where you get to question yourself, question who you are, what you are in the society, where your place is in the society. Then how much more for an immigrant, a child who has just come into a country, a society that is completely different from what you're used to. The challenge is real, and they're facing challenges of a different value system. They're facing challenges of different beliefs, you know, and just like my colleague said, Mr. Adetula, he was saying how, you know, the accent, the language, so many things are different, are different. And this is another pressure. It's another pressure on a teenager, is another pressure on an adolescent, is another pressure on any child. Even us as adults, you know, it's a pressure on us that I want to be able to speak, that people understand me. I want to be able to understand this new world that I'm living in, you know. And so the truth is, the identity of anybody is questioned, especially for an immigrant child, especially for them within this context of a school, trying to navigate themselves. And then they end up being lacking motivation. Sometimes they end up being withdrawn socially. You know, you can imagine if I speak and they make fun of me, I will actually go mute. I will not speak anymore. I'm not going to answer any questions within the classroom. I'm not going to say anything because I do not want to be made fun of, you know. So I think those are the challenges that come in and that can make one have a mental breakdown.
Thank you, madam. But then, real quick, you talked about identity. So this, I know we've heard a lot about identity crisis, and like you've explained how it's kind of set in that a child
Yeah.
doesn't feel out of place. So how does it express itself now? How does identity crisis that an immigrant black child in the UK, how does it express itself?
Yeah, I kind of touched on it. So it does express itself in
Yeah.
the sense that kids are questioning, you know, if they have some sort of relationship with their parents. In this, what I mean is that they know that they're going to be listened to. They can come back home and now ask you or tell you, you know, I've had a situation like that where my child, he was young then, he was not even yet a teenager, and he just comes home and says, I want to become white. And would you blame, you know, he was even born here. He was lucky to be born here, but I am a first generation immigrant. So I'm the first person here. So he's born here, privileged to be born here. But he's observing that, look, I'm the only one around all these people. I want to become white. So those are the way it manifests. Sometimes you now see them trying to change their hairstyles, trying to texturize it just to make it look, in quotes, like the the people they are seeing around them. So those are the ways it manifests. And then within schools, when they now become teenagers, they become adults, young adults, it's more where they're lacking in confidence, they're lacking in, and sometimes it plays out in you misbehaving. It plays out in the sense that obviously you're quiet, you're obviously lacking confidence, and just like another word that my Mr. Adetula used, shame. You're ashamed of things, so you don't even want to present yourselves. So the manifestations come in that way of complete social withdrawal, complete not participating within anywhere, and because of lack of confidence, because they feel, I don't understand this world, I don't understand this situation that I'm in. Is it Webster, one of the dictionaries was saying identity crisis is basically a child experiencing a confusion in uncertainty or in a certain period. They're confused. So you can imagine normally you're having a crisis of that nature, and then you come into the UK where everything is even different. It is a nature. You're in that big world right now and you are completely confused, and you have to contend with all these things to fit into the system.
Thank you so much, Madam Ibi. Yeah, sure. Thank you so much. I'll get back right to you, but drawing from what you said, so if a child feels shame in who they are, there's a very little possibility that they would want to showcase their personality, their origin, their tradition, and who they are. And I can imagine for a very young child how distorting that can be. Like you said, a confusion. Thank you so much, Mr. Mensah. Are there real quick? Could you share with us if there are other risk factors that could affect Black children in the UK? I know you've had experience in the UK as well for while you're doing your doctorate. Yes, sir.
Yes. So yes, the literature or the data that has been collected does clearly show that ethnic minorities generally have increased risks of mental health issues. A lot of it has been touched on too. The details as to the whys are still yet to be researched, but we just know that these are risk factors. So, for example, like Mr. Adetula has touched on the socioeconomic issues. Data from the study that I was quoting earlier on show that, so like in homes where the educational qualification, the parents have no educational qualification compared with a degree level or equivalent level, children there tend to have about 15% prevalence of mental disorders compared to 6% in homes where the weekly income is less than £200, for example. There's a 60% prevalence compared to about 6%, so on and so forth. So the socioeconomic case has been quite made. But one area that I also wanted to emphasize, which others have also touched on, is the sociocultural dynamics that make it peculiarly problematic for those of us, the Africans in the diaspora. What we call the high pressure immigrant mindset. Their parents came to the UK or wherever they migrated to with a very strong and hard drive to succeed. They left the home country for a reason. And for many parents, you talk to them and they tell you, I'm doing this for my children. I mean, I have cousins, even though I was born in Ghana and raised and live in Ghana, I have cousins here who, so I understand the mindset, like we came here to make it in life and we are doing all this, so we're sacrificing for our children. So from the point of view of the child, it's like, the parents means well. They want you to do well in the society that you are in, things like that. But from the point of view of the child, it's like, I'm carrying not just my own dreams and aspirations, but also the aspirations and dreams of my parents, which can be a huge burden if it's not properly managed. And that's why, let's take a good example. I was talking to one of my cousins recently, and it was a very interesting conversation. She had different career goals, and her parents were like, no, you must be a doctor. And, that kind of thing, which is not, I'm a doctor myself, so I'm happy for anybody to join my profession, but just like the dynamics of the pressure of it, of you have to do this because we didn't get on the boat, so to speak, and work our butts off for you to come and be doing nonsense, as they say, so that can also add quite a bit of pressure. So from the perspective of the child, teenagers already generally feel pressured because, like Ibi has said, you are defining your identity and so on and so forth. And then on top of that, you have your parents' aspiration. On top of that, you have your whole community's aspiration, on you. So it can get a bit much if that whole process is not properly managed. And that's when, if it goes really all right, you can have issues of like rebellion, countercultural, behavior that is like all of a sudden it's like, okay, you know what, I'm tired. I'll do whatever it is that I want to do, But there are other things, lack of awareness about resources. I think Mr. Adetulu is going to touch on that later on about resources here in the UK. We live in cultural silos when we are here. So like if you're Nigerian, you go to a Nigerian church, you fraternize with your Nigerian cohorts and things like that. So if we are not careful, I mean, which is again, it's not a bad thing because it helps the child to also, culturally identify and things like that. So it's not a bad thing necessarily. But the downside of it is that because we live in our own cultural silos and subcultures within the wider host country culture, we can have a situation where we are not even aware of the resources that are available, in the NHS and so on, particularly for mental health. And we just apply the same old ways that we have known to solving things. So like if there's any mental health issue, it's like, okay, let me talk to my church pastor, which again is not a bad thing, but there are other resources available that many immigrant communities are not aware of. And then yes, and then generally just the attitudes towards mental health, issues of stigma. We don't talk about it. If you are feeling, it's like it's, particularly when it comes to now like male child dynamics, be a man, you can't. I'm very sure we'll touch on all these things, but
we will.
There are definitely major risk factors for the Black community in the diaspora. Yeah.
Insightful, very insightful. Thank you so much, Mr. Mensah. It's very critical the perspective you've brought, how that the pressure of I must do this for me and my family kind of put down the mental crisis that is possible. And then these children are meant to understand it from a very young age. You're here to make a way for others behind you, right? So thank you for sharing that light. Madam Ibi, you're a teacher in the UK. Would you share with us real quick, please? What are some detection method that teachers and parents can use to detect when a child is going through a mental health challenge, and how much of this is being used already, please?
Okay, thank you. You asking for the methods that are used. The truth is, mental health, unlike any malaria, you have a headache or things that can manifest, a rash that you can see. Mental health is something that is not my understanding anyway. I'm not a specialist, but that you can't see it clearly. So detecting that it literally takes a relationship between parents and teachers and between parents and their children. So detecting this, the one of the ways I know my school personally went out, especially because of the high rise of mental health breakdown across board, not just Black minority or the white children, was to try and bring up a course that they worked ahead, hand in hand with NHS, for us teachers to undertake, which was the mental health first aid. That means you being the first responder, to situations when you see. But the only things are things like when you see a child cutting themselves, when you see a child, going a bit different from what you're used to. But that is also takes a teacher who is intentional, a teacher who is, observant to know that, there's something different. Now, me saying that cutting yourself, how would you even notice on a Black skin? You can notice that more on a white skin, that there's marks on a child's body, but it's very difficult on a Black body, so detecting it is really very difficult. Detecting it is really a challenge that I think there's a gap, and there's a lot of work that needs to be done within the school society, and also between parents. So even parents are going to struggle to detect breakdown of a child. If you don't normally have a relationship of communicating with your child regularly, not just giving instructions, but actually having a dialogue, actually having a relationship with your child, so your child can come and offload to you, and you are actually listening, not quick to correct them. You are listening to them, saying things like, this person said something, and then you being their guide, you giving them the tools to equip themselves within that kind of society. And obviously you have to understand it yourself, and it's I wouldn't say there is anything in particular in place, that we are using as teachers now, talking from a teacher's perspective, to say you are detecting
Yes.
that, but observing your kids, the students in front of you,
Yes.
observing that they're the way they are behaving has changed. Then you have the
Change a
challenge.
bit.
Yes, you now have the challenge of, will that child actually speak to you? If you do ask, will they tell you anything? Because do they trust you enough? You know, the cultural bias also, again, coming from home, where you're not supposed to air your
Yes.
dirty linen outside. You're not supposed to tell people all your whole problems, you know. Will they share? Will they actually open up to
Yes.
this teacher? So it's a very difficult case or concept going on within the school, within the world, to be honest, you know, for you to be able to decipher and to detect these things. I had a situation where a friend of mine, her daughter tried to commit suicide. Now,
Wow.
how would she have missed that? Because the child is quiet. Yes, she does talk when she has to, but as a parent, there's a lot we don't know, and you really, really need to be more involved. You really, really need to. I'm not saying that that person obviously did anything wrong, because, like I said, it is something difficult to actually detect. So it takes a lot of work on your part to actually build up relationship where you can notice things quickly and ask for help when you need it.
Wow. Thank you so much, Madam Ibing. Parents, teachers, everyone that deals with children need to look in depth beyond the surface to know what is actually going on. And then we could take some training too, right? If possible, to help that. Sorry, Miss Oyinkanshola, you work with the NHS, Madam. Madam Ibi was mentioning a course, her school too, from the NHS. And then I guess that's like a solution. Are there some gaps? Real quick, could you share with us some few gaps that also exist on the NHS level? I know Mr. Desla has mentioned the referral and all that. Could you share something extra, please?
Yeah, thank you so much. To me, I don't feel there's any gap in what she shared, because this was actually established by the government in 2017, and it's like a green paper, like it's for transforming child and young people and with mental health. So it's built on national NHS transformation. So basically, just like she said, it's just like a program whereby it's establishing mental health support teams in education settings. So this was jointly delivered with Department of Education, as she said. So basically, what we do, like NHS, what they do is just that they create evidence-based training interventions to mental health lead support, like in the school. So they give timely advice for schools and colleges. And one thing we need to know, basically, 1 in young 10 people always have like a mental health condition. So this intervention, actually, their first consideration is to reduce health inequalities, which I feel it's good. Like when we are talking about Black people and looking at it, there are some different health inequalities whereby most of them actually happens to BAME. So this intervention, their first consideration is to reduce health inequalities. So that's why they have to collaborate with the Department of Education, whereby they provide NHS, we provide mental health advice to the mental health lead in schools, in each school and colleges. So, and also this intervention is also supervised by the NHS.
Wow. Thank you. Thank you so much for explaining that. I'm sure any educator or school leader listening right now knows about this support and can do well to get it for the teachers within your school. And just one more question. Can parents also take this mental health first aid course?
Yes, they can. One thing that, just like Mrs. Oshino said, it's more like it has more work to do with with the parent, actually, because they tend to know if their children are changing or if they notice anything. So I feel it is more of their responsibility, even though the teachers have the responsibility. It is more of the parents' responsibility, because they know how this person behaves. They know what this person does. Okay, even if this person is angry, they know to the extent that he or she can relate to. So it's more or less like it's a support, and the support team, you can actually tell, like this school, just like I said, and since in most schools and colleges there's a mental health lead, so it's just like signposting them to the necessary resources or the necessary interventions that is in place. It can be through this. maybe through the mental health lead can take it from there, and also maybe if there's any need for signposting to the NHS or towards or some crisis resolution team, yes, they can signpost to that extent.
Wow, thank you so much for the clarity. Thank you. Let's take a deep dive into Africa. Now, Mr. Mensah had spoken of the tons and the how very, very deeply Africa is in mental health challenges, especially among children and adolescents. And I'd like to start with you, Dr. Dugbe. Thank you for joining us today. You are an educator of educators. So you have dealt with a lot of people who have dealt with a lot of people. Through you, we have large group of young people that are connected. So would you share with us some risk factors that exist in Africa as concerning the mental health of children, please? Yes, Madam Dugbe, can you hear me? Sorry, you're muted, please.
Oh, okay.
Yes, madam, we can hear you.
Can you hear me?
Yes,
can you
yes.
hear me now? Yeah, okay. Thank you very much.
Yes, we can.
There are many risk factors affecting the African children. Some of them are child abuse, maltreatment. It will surprise you that even parents maltreat their own children, not only people who are living with them. Neglect, peer rejection, poverty, social isolation, loneliness, discrimination or racism, or discrimination even in Africa, discrimination among siblings, bereavement, bullying, poor physical health condition, traumatic experiences, early or late poverty. These are factors. These are many other. These are just some of the factors, some of the risk factors that contribute to poor mental health.
Wow. Poverty, bereavement, abuse,
Yeah.
all
Yeah.
of those things, they seem close to us than farther away.
Yes,
Right?
that's
Are
it.
people, yes. Are people really aware of all of this? Some people could just think it's some or one of this, but not all. Are people really aware of this large number of risk factors?
People are aware. They are aware that there are factors, but they don't know. They are not aware that there are risk factors for mental health. They are not aware. They are not able to link all these factors to poor mental health. Child abuse, they just think, okay, it's a factor, but it's so difficult for them to believe that it could go to an extent of causing mental illness. So people are aware, but they are not aware of the impact, and they don't know how great this can affect children.
Wow. Thank you so much, Madam. Madam Ibi was talking about identity crisis that was set in children of Black origin who moved to the UK. And I wanted to ask, is this also applicable in Africa? Is there a case of identity crisis in Africa as well?
Yes, it is. It's a general thing, and it cuts across
Wow.
colors, cuts across continents. It's part of us. Adolescence is a developmental stage that is inevitable, and it is during this
Yeah.
adolescent period that many children have what we call identity crisis. So whether you are Black or white, whether you are from poor home or rich home, you experience this. It is a developmental issue. It's a developmental
Yeah.
issue. And this period of adolescence is characterized by physical, emotional, and social development. This period is full of challenges as the adolescents strive to get accustomed to the changes in his body, new responsibilities, evolving relationships, and have a new identity of self, using the ideals, beliefs, and values of the society as a basis for it. So it's quite enormous, and it's quite a big challenge for adolescents. And that's why some people would describe this period as a period of storm and stress, because the adolescent has a lot to battle with. The adolescent has a lot to fight with. And coupled with the fact that they don't really know where they belong. Are they children? Are they adults? Some of us see them as children. They are still children. They see themselves as adults because of the physical changes that they are already having in their body because of the physiological changes that they are having too. Now, this is a period that they develop their own identity. It is during the adolescent period that they develop it. Although adolescence, the issue of identity is developed over a period of time and also throughout lifetime. But it is during the period of adolescence that the child begins to think of the identity. It's the first time the child begins to think of identity. And identity refers to our sense of who we are as individuals and as members of the society. So there's a lot with the adolescents at this period, and all these that they are going through, the changes in their body, the physiological changes, the emotional changes that they are having, all this results into possible problems, which may include conflict
Yeah.
with parents, conflict with teachers, searching for identity in groups, uncertainty about living childhood, and taking adult roles. All this lead to identity crisis. And so you will agree with me that everybody, it's a time, it's an inevitable period which we have passed through as parents, and our children who are adolescents are also passing through. So it is unavoidable. Thank you.
Wow. Thank you so much, Dr. Dupe. Unavoidable. Madam Ibi talked about confusion. That was her word, confusion, in the mind of Black children in the UK. Now, in Africa, our teenagers are belabored with the brunt of growing up, finding their identity. You had shared that even though this goes on for throughout life, it is majorly developed when the person is young, as a teenager or as an adolescent. Thank you so much, madam. Miss Idowu, please, would you share with us to what extent is this prevalent? I know you have a background in sociology. How prevalent is this case of identity crisis? Like, how far has it gone? How many persons are implicated from your experience, please?
Well, first of all, thank you for having me here. I'm excited to lend my voice to this important conversation. When we're talking about identity crisis, like most of the speakers have established, it is a common, phenomenon, and it affects children across board. So specifically for African children on African soil, this is the same process they have to go through, especially during their preteen and teenage years. And as a mental, risk factor, if they are unable to adopt healthy coping strategies, it predisposes them to mental health conditions, such as anxiety, social anxiety, um, the speakers have established that it is an intense time of uncertainty and confusion. So even for adults, adults experience identity crisis, commonly maybe midlife crisis. So how much more for a child who has, so much to contend with? I know Dr. Kwabena was saying that many would say children have no problems. But I tell you, children do have problems. Madam Mudupe also mentioned that, some of them see themselves as adults at that stage, and the truth is, for an average African child, um, it is at that stage that they adopt so much responsibilities, and in fact, adult responsibilities. I have had
Yes.
children that the minute they leave school, they're running off to, say, their mother's shop or their father's businesses. Some have to go pick up their younger ones from school, take care of them. So there's so much conflicting, emotions,
At
conflicting
once.
at once, at the same time they are going through, and having an adult look at that and wonder what is the child thinking of might be quite unfair to them. And this ignorance is also what further leads to these problems, because they are growing up as unbalanced children and they end up becoming
Yeah.
unbalanced adults. And when we're talking about identity crisis as well, we have to take cognizance of other circumstances that might have accompanied their social
Yes,
development,
please.
talking about traumatic events they might have encountered, having a traumatic childhood. A speaker
Yeah.
mentioned child abuse. These are things that children could be facing: sexual abuse, it could be malnutrition. It's a couple of things. And we also talk about culture, like in Africa, we have certain cultural myths that would could also influence the identity crisis a child may experience. take for instance a child that is born out of wedlock. We are big on such myths, and this child might be ostracized socially, saying, oh, this is your outcome, this is what you might become, and such a
Yeah.
child is confused, wondering where exactly do I belong. And also, again, an element of identity crisis will be talking about attachment and authenticity. With attachment, as social beings, we want to belong, right, to a group. And at the same time, with authenticity, we want to be in tune with our feelings, we want to be in tune with our body and with our values. And when there's a clash between these two, usually you lose authenticity. Authenticity will have to bow to attachment because you're just finding a way to belong somewhere. And this is
Belong
where
somewhere.
a number of, yes, crisis will set in for teenagers, for children, and they might start to exhibit this with rebellion, truancy, and it leads to further advanced problems like substance abuse, like depression. They're persistently sad, nobody is talking to them, asking them questions. They have lost interest in the things they used to find joy in. It's quite complicated, and it happens
A lot.
a lot on African soil. I think the onus still remains with parents, with guardians, with teachers, all the stakeholders that have um day-to-day interaction with
A part
children.
to play with the children.
Exactly, to ensure that their
Mm.
value system is intact. And for parents as well, the more you express, the more you model the attitude of self-awareness, the more the children to pick up from you. The more they find it easy to
Wow.
come up to you and say, oh, mom, this is what I'm going through. Dad, this is how I'm
Wow.
feeling. This is what I'm experiencing. And
Thank
it,
you.
it then gets easier to detect these challenges and these problems. For an
Thank
African
you.
parent sending maybe their children off to school or somewhere, they would, or Yoruba parents to be specific, they might say, "Rántí ọmọ ẹni tí ò ń jẹ́," which loosely means remember the child of whom you are. But if as a parent you're able to model the kind of value system you want your children to retain, you might not even need to remind them. It stays with them wherever they go. If they move way outside of the country, they're in continents away, it stays with them. And these are very
Thank
important
you.
elements to
Thank you.
display. Thank you.
Thank you so much. Thank you so much. That's a lot. You've actually answered both to the extent and why these things happen, and you've actually expressed it on both on the parents and every other person that relates with the child. And I must appreciate you. And I really want to go on real quick. Mr. Mensasa, I know your research in Cambridge has a lot to do with culturally fit assessment. Yes, and from what Madam Dukwe said, a lot of persons know the factors as factors, but they don't know, they can't tie it to the mental health of children. So, in your research, could you share with us, real quick, how assessment, how popular is assessment? Real quick, then share with us on a broader note your work on developing culturally fit assessment tools for mental health in children and adolescents. Yes, sir.
Right. So the picture with assessments in many sub-Saharan African countries is we generally do not have our own tools. We use Western developed tools largely, and the problem largely lies in the fact that we use them as they are, without much cultural adaptation. At best, you get people maybe translating it into a local language like Yoruba
Wow.
or Twi, my own language or whatever, but that is not exactly enough for the same thing. So like I'll give you a quick okay, so let's take even from the English point of view. Most of the tools are Western tools, so they are written in English. Now I found that with the tool that I was working, one of the tools that I was working on specifically, it's an English tool. It assesses executive functioning, which is like a type of brain functioning. You have problems with that type of brain functioning in disorders like ADHD, autism. There are many disorders, bipolar, so on and so forth. Now, there's this item that asks. It basically says, "I have trouble sitting still," or "I have trouble keeping track of my work," or I think it's something of that sort. Now, I went in there assuming that, well, trouble is a very simple word. And this is a tool that's supposedly designed for ages 6 to 16. I decided to be a bit conservative, and so I said, okay, I'm going to assess only 12, 13-year-olds and upwards. And I found very interestingly that my own assumption that, I mean, based, that the word, a simple item like I have trouble um, keeping track of my books or of my possessions, or I have trouble sitting still, would be easily understood because it's not a complicated word. I go in there and I find that the vast majority of teenagers, both in the rural and urban areas, but most mainly in the rural, and even and this was both in Ghana and in Nigeria, were understanding the word trouble as I get into trouble. So like I have trouble in the sense of my teacher will punish me if I blab, etc. Whereas the word is actually trying to say that I have difficulty, I have trouble, So like at that, even as something as basic as that in terms of understanding, as we say, English is truly not our language. There are major problems there. So this kind of tool, if you take it and then you give it to somebody to fill, that will answer these questions, and based on that, you're going to diagnose or screen them. They'll write all sorts of answers understandably differently than you do. Another thing that I found interestingly was that culturally we don't seem to attach a lot of importance to an awareness of our internal state of well-being. So like our emotions, as opposed to like feelings. Even in terms of the language, at least in the two languages that I worked in, which is the Akan language, the dialect culture in Ghana, and then in Yoruba, we even struggled to translate the word emotion as it is. The best or closest we could get was feeling, which feeling is a very broad word. Feeling can mean like physical touch and so on and so forth. And I found that very striking because when we asked items that had to do with our emotional state, so things like there's an item like I'm unaware of my behavior when I'm in a group, or how my behavior affects others, the people were really struggling to understand the concept of like an internal state. At best, we have individual words for specific emotions. So like sadness, we have a word for anger, we have a word for, but for a word that describes emotions generally speaking, or how your internal state is, at least in the languages that I use, we don't have any word for it, which is very interesting because it tells us all we need to know, that at a very, very deep conceptual level, many cultures, if you now want to talk about like things like emotional disorders and emotional challenges, we are going to talk a lot about like being in touch with the emotions of your children. It's not it's a deeper problem than we may realize it, especially because I mean, maybe from where we are coming from culturally, it's not something that people put a lot of importance or attach a lot of importance to, and so we have a lot of work to do. I'll mention this other interesting finding. In urban areas, there was a lot of difficulty with parents adequately parenting or supervising their children. In fact, these were things that the parents themselves told me. So I worked in various areas in Ibadan, in Bere, for those of you who know Ibadan, Okeofa, and some urban areas in Ibadan, as well as in Kumasi, Fantinuta, and so on and so forth. And one of the biggest complaints that I got was parents themselves telling me that they do not have time, or they do not make time to actually actively supervise their children, and many of them were very, feeling very guilty about it, and they perceived that was the underlying cause for a lot of the behavioral problems that we were describing and trying to conceptualize and trying to ask it in a way that they will, all understand. So there are I mean, the bottom line of what I'm saying is that there are real issues with just taking a Western tool and wholesale using it in cross-cultural context without doing adequate cross-cultural adaptation to make sure that the people that you are asking the questions to, they understand the concept in the same way that you, the researcher, or you, the Western trained researcher, understands it. And two, that you are actually communicating the items to them in the way that you hope to basically make sure that you're on the same page. Otherwise, they are answering a question that in their head, they think that's what you are asking, but you are asking something totally different. And especially if their mindset, and I'm sure we'll talk about it later, their mindset about the behaviors they are asking is completely diametrically opposed to your mindset about it. You are coming at it, that so from your training in mental health, a child that cannot sit still, for example, or a child that has difficulty with emotional regulation, anger outbursts, and things like that. Sometimes it could be mental health issues or mental health problems that are causing it. But to them, there are many times where parents will tell me, "Oh, as for this one, this is not doctor sickness. It is either character flaw or spiritual, or some other things." So you are asking,
or the child is just being stubborn.
Exactly. So you are asking and expecting like the same type of honest answers that you would get if a doctor or a health worker or a nurse were interacting with someone. Like if I was asking about your fever or your cough, we don't expect you to feel somehow or some way about it. You answer honestly, but in their minds, especially if the parent feels that it's a reflection of myself. So there was one place where I went, it was a very Islamic community, and all the women were like, "Oh, our children are perfectly behaved, alhamdulillah, we don't have any problems. They're all, So one of them eventually said, like, "Look, you just be honest. Nobody's perfect. Don't feel some way about it. We have children with these problems in our community." That was towards the end of my interview. It was very frustrating, but very interesting for me because of the way they conceptualize it. It's like it is the parents' fault if the child is behaving this way, and because they've told me earlier that they've not been supervising their children very well. So you, as the health worker, will be interviewing the person, thinking that they are thinking about it in the same way that you are conceptualizing it as, this is mental health issues, it's not my fault, it can happen to anybody. To them, it is bad parenting or it is character issues or whatever. So they may not either be honest with you, or even if they are honest, they may not understand it the same way that you do. So there are real issues and challenges with when it comes to assessment of mental health problems or difficulties in a cross-cultural context that needs to be highlighted, it needs to be understood, so that we can now attack or approach them in the ways that we will really end up on the same page with the clients that we are working with, and then we begin to get really reliable and realistic answers. Yeah. Hello.
We can hear you.
Hello? Okay, good. Okay, she was a little bit off. Okay.
I think the moderator is having issue with her internet. Yeah.
With this thing. Well, then maybe I can touch on a little bit more on one other finding whilst we wait for her to get on. I touched on the impression of like a lot of parents with a lot of these behaviors as describing it as more like character flaws and things like that. So for example, problems with cognitive flexibility, which is one of the domains of executive functioning. So when a child has certain types of brain problems, like maybe a child has ADHD or maybe autism or whatever, they may have difficulty with what you call cognitive flexibility or like task shifting. So moving from one task to another is problematic. Their brain is not able to process it. Their brain is not able to process it very well. Okay, you are back. Where? Or should I continue?
Yes, I'm so sorry. I think the network connection kind of was disconnected.
Yes.
But real quick, we're short of time already. Mr. Ebuka,
Right.
could you tell us about your experience working with boys in Africa as well? You're muted, sir. Yes, could you tell us about your initiative and maybe perhaps a personal experience about how you were able to dictate a mental health challenge in a child and what you did and all of that? Just real quick, please. Thank you, sir.
Thank you very much. Thank you very much for having me. It's been a beautiful time and wonderful time. The conversations are really timely. All right. I'm the founder of Save the Boys Initiative. I'm a boys coach. We mentor, equip, and empower boys to live positive and productive lives. And so we are very, very keen on raising boys, right, and helping them understand who they are in this time and live the kind of lives we want to see them. So the issue of mental health is also very key among boys and men, because sometimes when we talk about these issues, we feel it's just a woman teen, or is a girl's teen. That's why we're even having higher rates of suicide in men, even though more women attempt the act, but more men even take their lives in suicide. All right, because most times it's not something we talk about. We just feel the men have a way of handling their issues, or and a lot of men don't even seek help for mental health issues. All right, they just feel they can handle it, and we are having this affect so many people. So in my work with boys, I've seen that being a major challenge, even with boys, where they are not able to really speak or talk about how they feel because of the societal, social cultural norms that lies about men don't talk, men can handle it, boys are okay, they can take care of things, and a lot of men and boys are deeply struggling with this issue. We've handled several cases, and one of those very difficult cases we've seen is a case of a boy who was really going through a mental health issue, was really, really depressed. His mother was late, and I think the father was also suffering from the, depression of the death of his wife, and started pouring that aggression on the children. And he will always say very negative words to the boys, or this particular boy, you're the reason why, is this your trouble that killed your mother, and all of you are blockhead, And even when the boy was telling the father that I'm also going through deep issues, I'm struggling academically and so many issues. In fact, one of those days, the boy told me that I told my father I was having suicidal thoughts, and my father said, it's better I even die. What am I waiting for? It's better to be dead than living, because both of them were struggling. Even the man doesn't know he was having a mental health issue. He just felt it's one of those things people do when they lose a loved one. Okay, and one day the father said to the boy, "You're a failure, you're a blockhead, and nothing good can come out of you." And the boy told me that, coupled with the issue he was going through, he just told himself that he was going to ensure that he shows the father that he's a failure, since that is what the father feels about him, and since the father can't even understand what he's going through. You know what it means for a father to tell a son who is having suicidal thoughts to take his life, that there's no need living. And this boy, for over 4 years, kept bringing a failed result just to prove that to his father. And it was a serious issue. He was going through depression, having suicidal thoughts. He kept feeling. Why? Because the father couldn't understand what was happening, to even connect, to know that this is serious and it can even lead to suicide. And it took a lot of intervention to bring the father to that place. But it was even difficult for him as a man, because he doesn't understand these things. And when we're talking about mental health, it's like, what is mental health? This boy is just, is just stubborn. And that's what people always liken to boys who are having this issue. Oh, they're just stubborn. They don't want to hear. They're just violent. But these are the signs that this boy is displaying. But, the father doesn't understand. His society don't understand. And we've seen this play out in many homes where they begin to display these things, especially as they go through puberty, but most times you don't understand it. It took us a lot to help that boy find hope and meaning again in life, and we saw how that even deteriorated to affecting the health of the father, because they lack understanding of the mental health issue and the societal norm that lies that men and boys don't have these issues. And we've had these cases in many boys as we work with them, who keep sharing deep experiences of issues. They say they can't talk about it in the society. If you talk about it, you're seen as a weakling, you're seen as a sissy, you're seen as a girl. They ask you, why are you behaving like a girl? Why are you crying like a girl? Men don't express. I've been to cases of programs where boys or men talk about their issue, and people just laugh at them. Oh, really? Are you a woman? Why are you crying? Why will you be depressed? You should man up. And it's making a lot of men to bottle up their emotions, and that's why having a higher rate of suicide. So I'm so glad we're talking about this, and also streamlining to children, to boys, to men, to women, to girls, knowing that mental health issue is happening to everybody, and we must begin to pay attention to everyone, as that is very critical. Thank you very much.
Thank you so much. Real quick, what the flyer of the Save the Boys initiative is out. Everyone do well to look and follow them on their social media handles to keep up with events that will be going on. And thank you so much, Mr. Ebuka, for sharing to us that it's not just girls, it's not just girly to express emotion or have a mental health challenge. These are some of the myths and make it difficult for people to detect mental health crisis, especially in male children and adolescents. Thank you very much. And thank you to you, Mr. Mensah. I'm sorry I missed your talk earlier on the cultural live fit assessment tools you were sharing with us. and I appreciate you for that. So let's go real quick into the solutions. And Mr. Ibuka, I would also have you talk about what parents can do going forward. But then let's talk about the solution. We've spoken much about the risk factors, the problems, the gaps, and the difficulties. Now, what can be done? I'd like to, since we're short of time, please let's just get right into it as we begin the share. And I'll start with you, Madam Ibi. Yes, Madam. Please, how can schools play a role? I know you've mentioned about the first aid, the mental health first aid. Is there anything else parents and schools can do to help children, Black children in the UK? Yes,
To yeah. Thank you. Yes, there definitely there's lots of things that we need to do as in the school community, and definitely more training, anti-racism training, unpacking the curriculum to make it more effective and to cut across borders to be able to make sense to every child, which is obviously making every child included in the curriculum. You know, including all the biases, especially in the UK now, where there's so many all sorts of identities people identify with, you know, sexual differences, you know, there's so many things going on, and if they're making way for things like that, then obviously there needs to be a way of including the ethnicity and Black children in these changes that are going on. Also, I would say definitely for individuals or teachers themselves to go out of their way to get to know and to get to know and understand.
Okay, Madam Ibi, are you with us?
Yes, I am.
I think we missed you for a moment.
Oh, okay, sorry. Anyway, okay, so I'm just saying that the individual teachers themselves need to go all out to unpack those unconscious biases that they all have. You know, every one of us human have some biases. So you see someone out there, and you've already made up your mind about something about that person. So now, as a white person, you have an unconscious bias about the Black child or the Black ethnicity. You know, not saying that you're racist, but you have it. Even us as Black or us as Africans, we have unconscious biases about everything and everybody. So as a school, one of the things they can do, obviously, to safeguard, to put things in place to support themselves and to support the children, all the children, especially the Black minority kids, is to do all these things to get themselves trained, to get themselves deliberately looking at ways to understand your child, the student in front of you. Then also to the parents, there's all of these things to safeguard. You need to genuinely look for ways of how to help yourself. You need to get to understand the way teenagers are reasoning, parents are reasoning. Parenting is a role that doesn't come with any form of manual. You just go along, but you need to equip yourself. You need to get to know things, or how am I doing this thing? Am I doing it right or wrong? You need to find ways, and there's loads of resources out there in books, in online, that you can use to equip yourself as a parent, as a teacher, to be able to address this problem, this concept, and to be able to support and help make these kids mentally healthy.
Thank you so much, Madam. So if our audience, if you're confused about these books, these resources, feel free to drop your questions on wherever you're watching us from. Madam Ibi and everyone else would do well to give you responses. Thank you so much, Madam. Dr. Dukwe, from the African perspective, real quick, as short as you can make it, what support can schools give? I know you are in the higher education. Yes, Dr. Dukwe.
The question again.
Yes, please. I was asking.
I was off the question.
Okay. In Africa now, where you are an educator, what support can schools in Africa give to help the mental health of children?
Well, I want to put it on record that teachers are trained. They are already trained as they go through their career to identify some early signs of mental health. We have trained them. But the irony of it is that even for them to identify, they must be emotionally stable. I mean, the teachers, they must also be mentally alert. Except because you cannot give what you don't have. And except you have this, a teacher may not be able to identify these early signs, which include poor concentration, excessive fear, worrying more, finding it difficult to make decisions, feeling overwhelmed by things, low mood, feeling sad, change in appetite, talking less, and all others, the teacher may not be able to identify. So I think the first thing is to ensure that, and there are so many factors that are responsible for that, teachers too are emotionally stable. Teachers too are able to master their own emotion, and also in the bid to express their emotions, they still have their head and they can handle issues, because everybody will one time or the other be emotional. But the fact is
Okay.
that one should be able, yes, as a teacher, to master, to understand your own emotion, understand the emotion of the pupils you are teaching, however how many they are in your class, and that gives makes the work of a teacher to be quite enormous. So they have put that in place to train teachers. They know they have undergone this training, but the fact is that there is need for retraining. We don't leave teachers when they have passed through the
Training.
training course and then you just leave them like that, because there are challenges that are emerging. There are contemporary challenges that are coming up. And so teachers need to continue to undergo training and retraining program on this issue. Well, we thank God for this program, this webinar. There is need to educate even teachers, not only parents now, even teachers about mental health, and parents too, because these children are coming from home. Any parents, many of us are learning so many new things there, regardless of how educated we may be. So let alone parents that are not even as educated as we are. Teachers should be trained to teach kindness, fall in love with what we have, what we are doing here, kindness to
Yeah.
others, kindness to the environment, kindness to others, so that you are able to accommodate other people, you are able to, you will not, there will be no discrimination. And I want you to know that even in the black world, okay, this is, we're not talking about a color difference now. Some teachers have a sort of a preferential treatment for other students. There should be no discrimination. This will go a long way. So teachers need to know all this and to show kindness, show love, be ready to learn, even as they are working, even as they are already teachers, be ready to learn new things and incorporate it into their teaching. In
Thank
schools,
you.
I know that the government has, can I, hello?
Yes, just go and finish up real
Okay,
quick.
okay. That I know that there are counseling facilities. They are supposed to be there, but unfortunately, government is paying lip service to this. There are many counselors in primary schools, in secondary schools in Nigeria, but they have not been given the enabling environment, to work and to carry out their duties. They have they've been given classes to teach, and so it becomes difficult to actually access these children and help them, or even refer them to psychiatrists if need be. So the machineries are put in place, but then they are not functional, and that is the truth. Thank you.
Wow. Wow, thank you so much, Ma. That one was very explicit. So there's a need for a change of mindset, both from teachers to parents. There's need for education and re-education and re-education. And I believe this is one of the education that is happening for teachers and parents of children in Africa. Thank you so much, Madam. Mr. Adetula, I know you had shared a little bit initially about the NHS. Could you tell us if there's more support from the NHS, especially for Black immigrants from Africa and other minority groups to the UK? Real quick, please.
Thank you very much. Presently, I'm not aware specific support for immigrants, but
Okay.
I'm aware of one thing. Now, in the past 10 years, NHS has actually invested in what they call improving access to psychological therapy, where people can actually have access to psychological therapy, and it's based on your area. So wherever you are, you may want to Google improving access to psychological therapy. We have for adults, we have for children, and we have for adolescents too. And we have what they call educational psychology practitioners that go to schools to see if we have children in the classes that may need help. Although presently the greatest problem we face presently is the number of waiting times. Some people have to wait 3-4 months to get to have access to that. And another thing that we also doing presently is what they call racial matching. Some some trusts have started what they call racial matching and cultural matching, where people from the same cultural background are matched with a therapist they could have access to. So if you're a Nigerian speaking Yoruba, they look for someone that speaks Yoruba. They call it lingual matching, and they speak to you and give you support. And beyond that, we also have third sector support, like the Black Minds Matter, like the peer support directory. Wherever you are, you can just type peer support directory. You can see people that might have the same problem, parents of children that are having the same problem, that you can have a support group together, come together to come and speak about it and see how all of you are coping with it. I think these are the support that are really present within the NHS. Thank you. Yeah.
Yes. Thank you so much, sir. Peer support directory, Black Lives Matter, and some other resources that you shared with us, the matching, the lingual matching, the racial matching, that's a lot. So please do not take advantage of this if you're in the UK, and we're sure it will go a long way. Thank you. And let's move on to Mr. Ebuka real quick, sir. Could you share with us, with all of the experience you have, what can parents do? So take this as like you're giving a last speech to parents out there for the mental health of their children in Africa. What would you tell them?
Thank you very much. I'll tell parents to go for knowledge. Like 2 days ago, we had a meeting where a parent was sharing on how her child had a mental health issue, but she never even understood what the child was going through at that time. She said, I wish I knew. He was even trying to explain to me, but I didn't even understand. I tell parents, go for knowledge. We're evolving. Times are changing. We must also evolve in our learning, in our understanding, in our gathering of knowledge. I keep saying a violent, a toxic father cannot raise an emotionally healthy child or even an emotionally healthy boy. We can't give what we don't have. So a lot of parents need to go for knowledge and understand what is happening at this time. And in our own space, even in our work with boys, so we need to tell parents, let's stop restricting emotional expressiveness in boys. We will keep telling them when they are younger, oh, you're a man, you need to man up, boys don't cry, men don't do this. I'll keep seeing that even our children. And when they're not going through things as adolescents, as teenagers, as young adults, they're not able to talk because we have modeled not talking, not speaking to them. So we must keep modeling healthy coping skills for our children. Even while they're younger, we must keep showing that, oh, you can express, you can talk when there's an issue. We must keep creating an environment for our children to express their emotion. Our homes must be safe havens for emotion, where children can come back and say, this is what I'm going through, without the fear of judgment or condemnation and all of that. So we must keep modeling that. We must encourage joyful moments, all right? We must provide mechanisms for feedbacks. A lot of homes don't have mechanisms for feedback. People can say, oh, I don't like the way this thing is done. How can we do it better? We don't have that system in our homes where children can come back, to express how they feel. Most homes don't even have routines and clear set boundaries where, this is what should be done at this time. Everything just happens. There's no structure. There's no guideline. And when we do that, we are not helping our children. And lastly, I would say we need to begin to help affirm our children and support them emotionally. When our children do well, we support them. Sometimes we always look for when they don't do well. Oh, why did you fail? Oh, why did you do this? Why didn't this happen? But even when they do well, there's no support, there's no encouragement, there's no love. All right, we must model that. We must support them. We must affirm them. Oh, you look beautiful. You look so fine on what you're wearing. Oh, you did so well. You can improve. You can do better. We must learn to even see the positive side, not just on the negative every time. We need to begin to model empathy. We need to begin to affirm our children and begin to help them see that they are superheroes. We need to be their champion. Every child is looking for a champion who can encourage and model empathy and help them to get to that success that they desire. We must wake up as parents because we are losing a lot of our children to this. Thank you very much.
Thank you. Thank you so much, sir. We must model, we must affirm our children. I believe parents listening out there are getting practical things we can apply. So we will move straight to a very special guest who is on our panel. We're privileged to have her. She is the first Nigerian female professor of psychiatry, the first female provost of the College of Medicine, University of Ibadan, and the former president of the International Association of Child and Adolescent Psychiatry and Allied Professionals, which makes her the first Black person to hold that position in 84 years history of the organization. She has her residency training in general psychiatry of child and adolescent psychiatry at the Lanchester Moore Hospital, Queen Park Hospital in the United Kingdom. She has tons and tons of training. I'll just move straight to introduce our guest. She is Professor and Provost of College of Medicine and University of Ibadan, Mrs. Olayinka Olushola Omigodun. We're glad to have you, madam. Thank you for joining us. Would you please, real quick, just put a word in to what we're discussing today from your wealth of experience?
Thank you very much to all the fantastic speakers, and also thanks to Dr. Kosi Mensah, who's dragged me into this. I'm actually in transit, and I'm doing a lot of things at the same time. But I would just want to say a couple of things. This has been a very rich discussion, which I believe should continue. But I want us to remember that mental health is actually a very positive word. Mental health comes from the word health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Many times when we hear the word mental health, we immediately jerk back because we think it's something negative. Everyone needs mental health. Our children need mental health. And mental health development starts right from even before a child is conceived and in the mother's womb. What is mental health? Mental health is the capacity to achieve and maintain optimal psychological functioning and well-being. It's important that we realize that mental health is a positive thing. Mental health is directly related to the level reached and achieved, and it relates to competence in psychological, emotional, and social functioning. Mental health relates to a child or an adult or an adolescent having a sense of identity and self-worth, sound family and peer relations, and the ability to be productive and learn. So I want us to take it from that premise, because mental health is actually, when we talk about mental health, there's a continuum talking about mental health all the way to mental illness. And so when we're looking at our children, particularly African children in the diaspora, we are thinking of how can we promote their mental health? What are the programs we need to have in place that will enhance their mental health, take their mental health to the next level? And these are talking about things that, promote things in the environment, things in the family, things in school that will enhance mental health, give them a greater sense of worth and identity. So that's one thing. Talk about programs that will just promote mental health. And this does not relate to children or adolescents with mental problems. We're talking about every adolescent, every child needs something that will promote their mental health in the homes, parenting programs that will promote mental health. And then we go on to talk about prevention. How do we prevent our children from having mental disorders? And that talks about looking at risk factors, talk about child abuse, substance abuse, psychoactive substance use, and traumatic experiences that would prevent. And then when a child or adolescent has a mental disorder, how do we access care and treatment? And then when they have had the disorder and they're trying to recover, what do we put in place to help them recover? Because I think it's important that we have a spectrum, because that would then help us as people, both on the I live on the African continent, and those in the diaspora, to be able to arrange for programs and activities that will deal with promotion, prevention, treatment, rehabilitation, and care and recovery. Very, very important. Now I'm going to talk about something that I really, particularly for the those who are in the diaspora. I've been very privileged to have raised my children, so I'm also talking as a mom, both in Africa, and I lived in the United Kingdom for 3 years. I also lived in the United States of America for 4 years. And I live back in Nigeria. And with due respect to all those who are living abroad, I actually think that it was much easier for me to raise my children on the African continent, right there in Ibadan. There were a lot more supports and facilities that helped to raise the children. And I can remember very clearly my daughter, when she left high school, she went on to Harvard University. And she told me something. She said, Mom, you know what? I'm so happy I was raised in Nigeria, on the African continent. And why was she saying that? She was saying that, you know, because I know who I am. I have my self-worth, my identity. I can go out and take on the world, because the environment in which I was raised has been very helpful to me, to give me a springboard to go out into the world. So I think those are some of the issues that we need to tackle. Because I'll give another quick example. I know two sisters who for some reason, one of the sisters raised her children in Nigeria, and the other sister raised her children in the UK. And the trajectories are so different, even though they're from the same system. And that's because of the strong environment. Where the sister who went to Nigeria, all her children were able to go on to have a good university education. They were all able to enter into a good marital relationship and have stable homes. The sister who stayed on in the UK had a totally different experience, you know, and I think those are things that those in the diaspora need to be aware of. What are some of the things that may be affecting or causing us difficulty? And I think a study that was done in the United Kingdom would give us a lot of cues to this. It was a big study, a large study that was done a couple of years ago. I don't have the reference today, but but they looked at the different ethnic groups in the United Kingdom. They looked at the Indians, they looked at the Caucasians and the Africans. And they found that when it comes to mental health, because I'm talking about mental health in a positive direction now, good mental health, the Indian families appeared to be the most secure and protected. And then they now went on to tease out what were the factors that helped the Indian families to have a better outcomes. Number one, family. I have a saying that I always speak out as a child and adolescent psychiatrist. Children are a window into the family. They found that every family had difficulties, but the Indian families appeared to have more stability. There was a mom, there was a dad. And then not only that, they lived within the intergenerational context. So they lived together, there was grandparents and so on. And then they were also able to keep their culture. They were able to speak their language. They were able to grow and express themselves within the culture. Number one. Number two, parental expectations. The parents expected that their children would do well. You know, there's what we call a self-fulfilling prophecy. If your parents don't have too much expectation of you, then it affects you. But the parents had high expectations. And so the children would do well at school, and then there was a lot of support in the social environment. Number three, religion. If you know, they had, a lot of them had religion. They had that, and religion provides a lot of stability for children. And it's good practice religion. And then they used to have a lot of meetings and gatherings together within their culture. So they knew who they were. One thing I found about quite a number of Africans, when they come out, first of all, they kind of scatter. Now maybe things are getting a bit better. Then number two, they drop their language. You find that the average Chinese kid, adolescent or child, can speak perfect Chinese and perfect English. They learn, they speak their home, so they have a sense of identity. I know who I am. And then they can go out and take on the world. And even though the world hits and bashes them, they return home and they know who they are. You know, and they also have their own names, you know, their language, so they retain their culture. People need identity. One of the problems that studies have suggested of, like the Americans who, the African Americans, Africans who were taken away as slaves many years ago, you know, they have a lot of problems in the US. One of the things is that identity. I don't know where I come from. I don't know where they were taken as slaves, so that tie was broken. So we need to start to come together. Parents, you need to, the children, you be proud of your heritage. You know, all these things give children a sense of self, a sense of who I am, and so on and so forth. And then expectations. Those two sisters that I was talking about, Whereas the children in Nigeria knew they were going to go on to university. The children who grew up in the UK, some of them wanted to be bus drivers and so on. There's nothing wrong with being a bus driver, but it's nice to have expectations. So those are some of the areas that I really, really want us to focus on. And I'm not saying we have lots and lots of problems on the African continent because of severe abuse, lack of information about how to rear children. And I think many times we bring that. Fathers are not involved with children from the onset. It's a cultural practice. A father will not become involved with a child until the child is in his teens. By then it's too late. The involvement of both fathers and mothers should start right from the womb as the child is growing. And so they know daddy and mommy. And then when the parents are together, there's no greater thing that can give children security. Although many times you find that if a mom, I was raised by a single mom because my father died when I was very young. But then my mom was there. She provided security. She always told me I could be the very best, I could achieve, and so on and so forth. So I think the time we're supposed to have ended for 2:30. So I'll just round up and just say that I think we need to have more of these conversations. And sorry, one very important last thing is that schools are very important settings for provision of mental health care, promotion, prevention, treatment, rehabilitation. And so we really need to get into the schools and make sure our children have the very best. And last but not the least, I'm happy about the gentleman that's working with boys. Boys. Many times there are a lot of programs that come in from the Western world, and basically they are focused on women empowerment, child empowerment. Our boys are being neglected. And interestingly, boys have more developmental disorders than girls. If you look at all the neurodevelopmental disorders, whether it's attention deficit, that is restlessness, autism, bedwetting, and all these disorders of development, they are much more common in boys. So girls and boys, talk about equity. They have different needs, and so the mental and physical care for them should be geared towards their specific needs. Thank you very much for this invitation.
Thank you so much, madam. You have educated us very largely. Thank you to all our speakers and our facilitators who has taken out the time to join this conversation today and share your knowledge with us. Unfortunately, this is how much we can take because of the time constraint we're tied down by. So we would like to encourage you, just in case you had dropped questions, be rest assured, as soon as we end from here, the questions would be answered, they'll be attempted. Yes, they will. So go ahead and send more info@africaness.com. The questions will be attempted as we're going on. The facilitators will be out on the social media platforms to also give answers to them. Thank you so much, everyone, for joining this webinar. Of course, we cannot take it all in one day. As we all have said, there will be need for continued support, continued partnership, continued education, continued consistency and intentionality to do what's best for the Black child, whether in the UK, in Africa, in China, or wherever in the world. Thank you so much for joining us today. And my name is still Chinyere Ndukoro, and I appreciate you for being here with me. Thank you so much, and take care. Bye.